Today, Jordan and I will be answering the question of should the US enact universal healthcare coverage? And Jordan is going to start us off with the pro debate. And I'll give it to Jordan.
Hello, everyone. My name is Jordan, and I'm going to be talking about being in favor of universal healthcare. Um, about 11% of US adults were unable to afford or access quality healthcare in the past 3 months. The US should enact universal healthcare coverage because healthcare is a fundamental human right and essential for a healthy, productive society. A system that ensures every person can access needed care regardless of income improves public health outcomes, strengthens the economy, and advances social justice. Um, Healthcare is a human right. Every individual deserves access to healthcare just as they deserve education or clean water. Treating health as a privilege based on income helps perpetuate inequality. Universal coverage aligns with global human rights principles and ensures equitable treatment regardless of race, socioeconomic status, or geography. You can go to the next slide.
All right.
No, you're good. Uh, Universal healthcare helps improve public health outcomes. Countries with universal healthcare, such as Canada and many in Europe, experience better overall health indi indicators, including lower infant mortality rates and higher expectancy because preventative care is accessible to everyone. Universal coverage reduces reliance on emergency rooms for primary care and improving efficiency and outcomes. And then there's an economic benefits of universal health care. Healthier populations contribute more effectively to the workforce, driving productivity, and helps reduce the absentees in the workplace. Universal coverage streamlines administrative costs by cutting out the ineffectiveness of multi-payer systems. And families are spared financial ruin from medical bills, and universal health care could help free up resources for housing, education, and investments in their community. The current US system spends more per capita on healthcare than any other nation, yet achieves poorer health outcomes compared to countries with universal systems. A universal approach can negotiate fair prices for drugs and services, removing profit-driven inflation from care. In the present system, marginalized communities suffer higher rates of preventable illness due to limited access to care. Universal coverage dismantles structural health disparities and helps advancing racial and economic equality. All other wealthy nations have adopted some form of universal health care and reap both health and financial benefits. Refusing universal coverage places the US behind in moral progress and undermines the global leadership on human rights. Um, Universal healthcare is not just a policy choice, it is a moral imperative that ensures that the health and dignity of all citizens fosters economic growth and brings the US in line with the global standards for compassionate, effective governance. And I'll pass it on to you, Mike.
Thanks, Jordan. I'm Mike, and I will be talking about the arguments for not enacting universal healthcare in the US. The first argument that is very prevalent are issues in government efficiency. Um, the American economy is one that's largely built on capitalism and the free market, which by its nature prioritizes efficiency to beat competitors. And this would lead to a worsening in general of the medical system with more errors and a lack of financial motivation for medical innovation, which would better overall healthcare practices and procedures themselves. Um, this is shown in America through primarily stuff like the Veterans Affairs, which is already a universal for veterans program where they receive a lot of benefits. Um, a really important example happened in Spokane, Washington VA hospital, where it failed to deliver more than 11,000 orders for specialty care, lab work, and other services without alerting healthcare providers that the orders had been lost. Um, There's numerous examples like this in other countries that have universal health care. Um, and one of the most important things we stand on as Americans, or that America was founded on, was um, having a system that was efficient through being run by the private sector. So it's something to consider in the argument against universal health care, definitely in the U.S. Um, the second major argument is the financial burden for the government and taxpayers. Universal health care, like all bills and legislation, needs new sources to fund the endeavor, and this, like the main primary funding, will inevitably come from the American taxpayer base. Um, and this issue is a huge issue, so it's not going to come just from the wealthy or just from one small amount of taxpayers. The most recent biggest bill that is under this umbrella is Medicare for All, a recent universal health care proposal championed by Bernie Sanders. And it would cost between 30 and 40 trillion over 10 years to enact what the bill wants. And it would be the single largest increase to the federal budget ever. From the data online, it shows that in order to fund something like this, payroll and income taxes would more than double in percentage to fund it, targeting both the wealthy and the middle class. And overall, the general effect would be that over 70% of working privately insured households would pay more under their new plans than they do for health insurance today through their taxation. Um, there's a lot of other data on this, and overall, like the need for taxation would arise, and it's an important factor to consider, especially with tying into efficiency, as I talked about in the first point. The final argument against this would be long waiting periods for medical appointments and procedures. The economic principles of supply and demand come into play very largely in this scenario, and it's been seen in other places like Canada or Great Britain. But when the supply does not increase of something like doctors or the even like medical devices, or the amount of procedures that can be done within a year or a quarter in the US, but the demand for all those things goes up greatly, and the access to those things goes up greatly. Um, and the amount of people needing that assistance that can actually access it, if it goes up greatly. There's several consequences like increased wait times for appointments or elective surgeries, greater wait times at doctors' offices and other facilities, or the need to travel great distances to receive medical care. And this is important because it could overall decrease how the medical system is actually helping people overall. And um, Canada, in 2017, there were over 1 million people on waiting lists for all kinds of procedures. And for one area, arthroplastic procedures, which are joint, like for instance, like a hip surgery where you need a hip replacement, the average wait time for that was between 20 and 52 weeks. So you're leading to some people that are um, really, really not benefiting from this system that probably would have benefited in a previous system. Um, and that's all I got. I'll leave it to Jordan to do her rebuttals.
Um, Universal healthcare is not just a policy choice, it is a moral imperative that ensures the health and dignity of all citizens, fosters economic growth, and brings the U.S. in line with the global standard for compassionate and effective governance.
The universal healthcare system would be one that sure greatly helps some people, but many people would really, really hurt from this endeavor. Um, and we would be hurting one of the most important things in our current state of affairs, which is the American ingenuity. New devices and treatments would possibly not be seen through this. because medical professionals wouldn't have as much incentive to find them. Companies wouldn't have as much incentive to grow, and it would lead to overall stagnancy, which would hurt us as a nation. Thank you. And here are
Thank
sorts
you,
of
everyone.